really just a very mild pain to excruciating pain, right? Because it depends on what the individual has done throughout the day. Can start off with just mild pain in the morning as they go through their day and they pick up heavy things, or they stand a lot or walk a lot, then that pain can become worse throughout the day, right? But it's still not as terrible as when we're dealing with a traumatic injury. Okay. Then we also have inflammation, as usual, the low-grade inflammation, right? And then something that is important and a little bit different from some of the other conditions is that this condition can interfere with your daily activities, right? If an individual experiences lower back pain, it can cause them not to be able to walk properly, right? So you'll see them walking like leaning forward, okay? Struggling to get up and down stairs, struggling to do household chores, right? Standing, washing dishes or cooking, even something like combing their hair can become very difficult and painful. So this condition, as common as it is, it can also interfere a lot with an individual's daily activities, right? Then muscle spasms, right? So in your back, you have up to your spine, your vertebrae, and then next to it you have muscles to support your spine, right? So those muscles can become very tight, and if the muscles become tight over a long period of time, they go into knots, right? And that is what we call a muscle spasm, right? So that can also, if it is there for a long period of time, it can become very painful, and it can also be very difficult to treat, right? That's where you go to a physiotherapist or a massage therapist so that they can release the muscle spasms, right? Then we have weakness, okay, now because of the pain, okay, wait, let's start here. Weakness of the muscles can result in the condition, right? That's one way it can happen. Or the condition is there, so the lower back pain is there, which can cause weakness of certain muscles, right? So either weakness has an effect resulting in the injury, or the injury can result in weakness, right? But it's weakness surrounding the entire core area. Now the core includes your abdominal muscles, your hip muscles, and your spinal muscles, right? So there can be weakness in one or all of those regions, and then that links to this one here. Because if your muscles are weak, coupled with pain, it makes it difficult to perform certain movements, right? And then the last one is posture changes. Like I mentioned earlier, you will see people with lower back pain tend to stand like this because it takes the strain off the lower back, or they will stand with their knees flexed, right? But if they change their posture and they maintain that posture for a long period of time, they actually start to adopt that posture, and that becomes their posture, right? So that's why it's important to treat it as soon as possible. Right, now how do we treat it? I mentioned your physiotherapy. So remember, your physiotherapy will be there to manage the inflammation, to manage the pain that they experience, and then if there is muscle spasms, right? Then you will have your anti-inflammatories. Remember, that's the medication that is prescribed if inflammation is present. Although we want inflammation to heal the injured area, we don't want it for a very long period of time, okay? Something else that's also different in this condition is muscle relaxants, right? So you get a certain type of medication that can be prescribed in order for your muscles to relax. So that is especially if the patient has muscle spasms. Muscle relaxants are then taken to try and relieve the muscle spasms, right? It is helpful, but especially if you have an individual who takes painkillers on a daily basis, then your muscle relaxants are usually not strong enough to actually relieve the muscle spasms. And that is when they then need to go and see like a physiotherapist to actually release through hands-on massaging to release the muscle spasms, right? Heat works well. Remember, it's an overuse injury, so we do not want to apply ice, but heat works well. One, because it reduces the pain that the patient is feeling, but then also it helps to relax the muscles. So it can help to release the muscle spasm. although heat by itself generally don't relieve the muscle spasms, right? But it does help, especially with the pain. Okay, then also something, a new inclusion is chiropractic manipulation. Now, I'm not sure if you guys know what a chiropractor does. Do you? So. Okay. So your chiropractors, I'm also still trying to do this myself, to be very honest, but your chiropractors work well with people with spinal injuries or spinal conditions, right? Because what they do is they work on the spine to try and correct either the posture or to correct the resultant muscle spasms, right? So what you find is your spine is supposed to be straight, right? Now, unfortunately, because of the way we sit, the way we stand, our spine, especially the vertebrae in the spine, tends to move slightly out of place, okay? Now, what your chiropractor then does, they use different methods. One of them is manipulation, right? That is basically where they like click your spine. I know a lot of you click your knuckles and click your legs and click your whatever. So they do it, but they've been trained to do it, right? So they will then manipulate your spine and your hips, because your hips have a direct influence on your spine, to try and realign it again. Okay, so to put it back into place where it's supposed to be, right? They also do what they call distraction. So this is where, if you now visualize your spine, remember it's one vertebra on top of another vertebra. Now if I stand, like I'm standing now, my one vertebra is compressing on the other one, it's compressing on the other one, compressing, compressing, compressing. Right? Because remember, gravity is pulling me down. So there's weight that's pulling my spine down. Now what they do is they place you on your stomach, and then they basically pull at your legs. It's actually, yeah, I've actually had manipulation before. It's a strange feeling because they pull you at your legs, but your upper body remains where it is. Okay, it sounds terrible. It's a minor pull. It's not like they're standing there trying to rip your legs off. It's a small pull, like a tuck, and then it kind of like separates the vertebrae from each other again. Okay, to where it's supposed to be, not further than what it is supposed to be. Right. So I'm very for chiropractors when it comes to spinal conditions. I'm still figuring out why they're working on the rest of the body. But anyway, we will figure it out one day. Okay, so physiotherapy, you guys know we've included that in most of our conditions. Bio, you know we've included that, but here chiros are included as well, right? Because I do see the benefit for chiros when we deal with spinal conditions. Okay, then biokinetics, so remember your bios then do kind of final phase rehabilitation. So once the pain has gone down, once inflammation has gone down, the patient will go and see a biokineticist where they then will prescribe exercises specific to their condition. Okay. So in this instance, remember we said the hip flexors are tight, so we'll prescribe exercises to stretch the hip flexors. We'll prescribe exercises to make the abdominal muscle stronger and the hamstring muscle stronger. Right. If the patient then also have like a weird posture because of the pain, then we will prescribe exercises to correct their posture again. Right. So in this condition, exercise is extremely important. Exercise can prevent the condition, but exercise can also treat the condition. Right. Okay, so that is lower back pain, better known as lumbago. Okay, remember that. That's going to be very important for next week, Thursday. Okay, just saying. All right. Okay, now the next one is whiplash. Yes.
What's the difference between biokinetics and physiotherapy?
Okay. That's like almost a story for another day, but let me give you the short version. Okay, so let's say an ACL injury has taken place. Okay, let's say it's a soccer player, they tore their ACL, they've gone for the operation. Immediately after the operation, they see the physio, okay? Because the physio does their different techniques to reduce pain, to treat the inflammation. If there's still swelling present, they treat the swelling. And then they start with basic exercises, okay? Like moving the knee through the range of motion, stretching some of the muscles. If there are muscle spasms, they treat the muscle spasms, right? Usually it's between 6 to 8 weeks. Then, what is supposed to happen, it doesn't always, but what is supposed to happen, the physio should then refer to a bio. The bio will then carry on with the exercises and get the athlete ready to return to sport again. Okay, but like I said, it doesn't always happen because, so if we look at the two professions, physio is an older profession. It's been here for hundreds of years. Bio has only been here around 40, 45 years, so it's not that old of a profession. So in the past, physios used to do everything from start to finish. Then bios came in and we're like, okay, but we also want to be part of this rehab progress, right? So usually 6 to 8 weeks with the physio, and then they should be referred to the bio, who will then complete the rehab until the person either needs to go back to sport, to their work or their occupation, or if they just return to like daily activities. That's in a nutshell. Okay. Alright. Whiplash. Okay? I don't know if you guys are familiar with whiplash, but it is basically it is a traumatic injury, right? And it usually happens in motor vehicle accidents. Okay? But there are other causes as well. So it is when this is your neutral head/neck position, right? So whiplash happens when the neck is forcefully flexed, usually hyperflexed, okay, so more than what it is supposed to flex, and then immediately thereafter forcefully extended or hyperextended. Okay, so if you think of forward flexion and extension, but think of it as going into extreme movement, and it happens very quickly. Okay, now as you can see in the picture, the cervical spine is obviously involved in this injury. And remember, your cervical spine is quite a sensitive area because it contains a lot of nerves, it contains a lot of your like major arteries, and then it also has obviously all your muscles and your ligaments in order to keep your head in an upright posture, right? So it's a traumatic injury, but it can have very severe consequences, which we will look at now, right? Okay, I've touched on that already. Okay, there you can see this is hyperextension, and there is hyperflexion, right? So if you look at the symptoms, now you'll see the symptoms for this condition is now a little bit different from like your other traumatic injuries. Okay. The first one is headaches. Okay, now the reason why an individual will experience headaches is because of the muscles that are involved. Now in your neck, the muscles run usually from your shoulder or your scapula all the way up into your head, not into your brain, okay, it doesn't go in there, but it goes all the way up into your head, and especially like the posterior area of your head. Okay. Now if those muscles were forcefully flexed and forcefully extended, they tighten up, almost like a muscle spasm, but now here in your neck muscles, right? And that can then trigger headaches. So headaches is a very common symptom in someone who have experienced whiplash, right? Then there's also pain and stiffness in the neck because of what I just explained regarding all the muscles, right? Then we have dizziness, okay? Again, neck muscles that goes into the head, and if they become so tight or go into a muscle spasm, it can cause dizziness as well. So feeling like you are losing your balance or feeling a little bit unsteady, right? Then we have nausea and vomiting, again, same thing because of the neck muscles. Struggling to remember things, so you can see there's a lot more brain processes, which we call cognitive processes, that are involved in this condition. Okay, problems with easy calculation, so someone who just experienced whiplash might not be able to tell you what is 2 plus 2 or 5 times 2 or whatever. Yeah, it's quite severe, all right. It's very much, and we're going to cover concussion, but it's very much similar to the symptoms experienced by an individual who had a concussion. Right. Okay, then numbness and tingling sensation. Now I want to go back to this picture. So obviously here's your vertebrae. The red is your arteries, okay, which obviously transports your blood to the various areas in the body, and then the yellow are your nerves. Now your cervical spine is the area in your spine that contains most of the nerves, right? Now when your spine is forcefully extended and then forcefully flexed, not only does muscles get damaged, but nerves can get pinched, right? Because what happens is they come out of each and every vertebrae. So in your cervical spine, your nerves go out in between every vertebrae. Okay. Now when it is forcefully flexed and extended, your vertebra compresses onto your nerves. Right. Now what happens when a nerve is being compressed is that you experience like a tingling sensation. So I don't know if you've experienced like, okay, if you sleep, for example, on your stomach with your hand like this, okay? Sometimes you wake up in the night and then it feels like your arm is like dead. It's like heavy, right? Now that is because in that position you were compressing or pinching a nerve, right? Now these individuals experience a similar feeling. So it feels like it's like tingling all along the arm into the fingers, or it feels like it's dead or heavy, which we call numbness, right? But that is purely because of the nerves that possibly got damaged or pinched during the injury, right? So you can see it can go into the arm, the neck, the back, the jaw, and the shoulder area. Now this is problematic because that entire area that I explained now, if that happens on the left side of the body, someone could suspect a heart attack as well. Okay, so that's why it's very important when a doctor sees someone who had whiplash to find out, is it only this symptom that is present, or are there more symptoms present? If it's only this symptom, then they will send them for like a cardiovascular checkup, right? But if it is this symptom along with some of the others, then they would suspect whiplash, right? And then the last one is that it even affects their vision. Okay, so they can either have blurred vision, or sometimes it's very bad that they have partial and temporary blindness, but it's temporary, it doesn't stay there. Okay, so it's important to take note of the different symptoms when it comes to whiplash. Okay, it's not the same as with your other traumatic injuries. Right, how do we treat it? Now, because there is so many structures, your veins, your arteries, your nerves, your muscles that go through your cervical region, they need to immobilize that patient, right? So you might have seen people with those neck braces that are being transported, especially like off a field. They always first put the neck brace on, then they put them onto the plinth or the board, and then they transport them out, right? Because any wrong move can cause the patient to become paralyzed, okay, because of the nerves that are being pinched. Right, so that's why the neck collar or neck brace is very important to stabilize the area and make sure that there's no other movement taking place in this area. Right, okay, they are given pain medication, anti-inflammatories, and then once they have been cleared, so what happens, let's say it happens on field, okay, it's a rugby player, okay, they will put the neck brace on or the collar, they will put them on the board, stretcher, yes, thank you, I'm trying to get to the word, stretcher. They will take them off the field and then they will be transported to a hospital, okay? Because any cervical injury, they won't treat them off the field, like immediately off the field. They will take them to a hospital, do all the necessary tests, and then from there on they will recommend treatment, right? So your physiotherapist will only come in once the patient has been cleared that there's no like further and serious damage to the cervical region, right? Because you're going to see a little bit later, we're also doing cervical fractures, which are actually life-threatening, right? And then, so once they've started with the physio will control the pain, the inflammation, and they will start with basic exercises, especially of the muscles surrounding the cervical spine. And then from there on, they will be sent for bio in terms of the final phase rehabilitation, right? So you will see I included different imaging, X-rays, MRI, CT scans. Right, now this is scans that are being done to see is there any other damage. Right, X-rays, you can only see bone. Right. MRI and CT scans, you can see bone, you can see ligaments, you can see nerves, and you can see muscles. Right. So they will start with the X-ray to make sure that there's not a cervical fracture. Right. A fracture to the bone. Then they will go for either MRI or CT scan to see if there's any nerve impingement, to see if there's any ligaments that got torn, to see if there's any muscles that got torn or injured. Right. And then that's when they then clear them so that they can go to a physio. Right. Okay, then I've spoken about the medical exam. Traction is something that is done within the hospital as well, just like chiros do it as well. So it's the same thing as what I've spoken about, the distraction, where they apply, it's like a chair thingy that the individual or the patient will sit in, and then they apply like traction or distraction within the cervical region, especially when there's a nerve pinched. Right, so they will push the one vertebrae off the other one so that the nerve can be released. Okay, surgery only takes place if there is something torn or broken or fractured. Then a surgery will happen. If it's whiplash at low level, meaning that there's just maybe some tightness in the neck, but nothing got seriously damaged or injured, they won't operate. Okay, because again, very delicate area with a lot of structures involved. Okay. Now we get to the seriousness of whiplash. Okay, so this one is like whiplash's older brother. Okay, you don't want to go there. Right. Cervical fracture, or better known as a broken neck, is again a traumatic injury, but it can be a fatal or life-threatening injury. Right. What happens with this injury? You can see there's your vertebrae, okay, your cervical vertebra. The yellow is your spinal cord, right? Now your spinal cord is responsible, it's basically a bunch of nerves, okay? It's responsible for the functioning of your body. If we didn't have a spinal cord, we wouldn't be able to lift up our arms, move our legs, etc. Right. So what happens is, with a cervical fracture, you can see that the actual vertebrae breaks, okay, or it fractures. And then it cannot go forward because there are muscles and your skin that protects the vertebrae that has been broken to go forward. So the only area that it can go is backwards, and backwards is the spinal cord, right? So once these fractured bones touch and pushes against the spinal cord, that is when an individual becomes paralyzed. Paralyzed meaning that they cannot use their arms, or they cannot use their legs, or they cannot use either of them. Okay. Paraplegic means that only one of the limbs are affected, so it's either upper body or lower body. Quadriplegic means that all four limbs are affected. Okay. So it's a very serious injury. It happens, unfortunately, very often in rugby. Okay. In your rugby scrums, in the incorrect form when they tackle. So it's very common in your contact sports, right? Okay, if we look at some of the other causes, okay, so a fall, especially from a higher than normal region, okay, so someone falling off a horse, but now remember, falling off a horse and landing on their hip is not going to result in a broken neck, right? It's falling off a horse, landing on their shoulder or landing on their head. Right. Also, bike accidents, motorcycle accidents, also very common. Normal car accidents, very common. People that are very drunk diving into shallow water or into a pool where they thought there's water. Okay, that happens there as well. Okay, severe and sudden twist to the neck, that is especially common in your rugby scrums. And then this nice tackle that has been banned from rugby.
A spear tackle.
Yes, the spear tackle. Okay, obviously landing directly onto the head or landing directly onto the shoulder, maybe with the head to the side, can all result in a cervical fracture. Right. Okay, what are the symptoms? Okay, this is the symptom, unfortunately. Right. Okay, pain. And pain can range. There can be mild pain or there can be excruciating pain. But pain is present. Pain in the cervical region, along with going into the head. Now, pain in the head is called a headache. Okay. Swelling and bruising, especially in the cervical region, because of the fractured bone or the bones that have broken, pushing against the spinal cord will result in bruising, especially in the posterior region of the spine. Okay. Tenderness, obviously, when feeling onto that region, it'll be very painful. Okay, there can be two things. It's either decreased feeling, so that pins and needles or numbness, or paralysis. Okay, it just depends how bad the spinal cord has been compressed. Okay. If there are a few fractured bones that are just slightly pressing against the spinal cord, then an individual will just experience pins and needles or numbness. Okay? But it is temporary and it can be reversed and the individual can feel like normal again. Right? But if those broken fractures or vertebrae is pushing straight against the spinal cord in such a way that the spinal cord is actually being closed off completely, that is when it results in paralysis or quadriplegia. Right. Okay, then your paralysis can also go just to partial muscle weakness, right? Again, depending on how bad the injury or how severe the injury is. I've spoken about headaches. Okay, then it can also influence your blood pressure and your heart rate, right? Because your spinal cord controls everything. Okay, it controls your heart, it controls your bladder, it controls your movement, it controls your arm and leg movement. It also controls your cardiovascular system, okay, so your heart, right? Whenever there's a compression on the spinal cord, it causes your blood pressure and it causes your pulse to lower, right? Which is dangerous because that can result in the second one, loss of consciousness, okay, and if it is maintained for a long period of time, loss of consciousness can result in death. Okay, so as I said, this is a fatal injury, okay? Not always, but it depends on the severity thereof. Right. How do we treat it? Okay, again, same thing. They need to immobilize the patient, so put on the neck brace or the neck collar, immobilize the patient completely, put them on the stretcher, and then transport them off. From there on, go to the hospital, do the scans, just like in the previous one, see what is the problem, see where the damage is, see the extent of the damage, so how severe is it, and then make a decision based on treatment, right? But this individual will remain in the hospital for a couple of weeks until they have been stabilized, right? So they will look at their vision, they will look at their blood pressure, they will monitor their heart rate, they will look at their hearing, their vision, everything and all the symptoms that the patient complains about, right? Only after those symptoms have stabilized will the patient be released from hospital. I don't know if release is the right word, but anyway. And then thereafter they will go for physio and then bio. Okay. Your surgery will happen in 99% of the cases, right? Because there's broken vertebrae or fractured vertebra, it needs to be corrected before an individual can be taken out of the neck brace or the neck collar, right? Any wrong move and those broken off pieces of bone can again further compress the spinal cord, and we now know what are the consequences of this injury, right? So usually it's recommended that they stay for up to 12 weeks within those neck braces or collars, even after the surgery has taken place, okay? Because there's so much damage because of the injury, they need to mobilize the neck region for as long as possible. Right. Okay, the last one that we're going to cover is concussion. Right. Now, concussion is also a traumatic injury, but this is now an actual injury to the brain. Right. So, remember, your brain is an organ. It's not a muscle, it's not a ligament, it's not a tendon, it's an organ. Right. So, concussion, again, also very common in your contact sports, but it can happen on a daily thing as well. So, motor vehicle accidents, maybe tripping on the stairs and falling, bumping your head, etc. Right. So what happens with this is, it is when there is a blunt force to the head. Okay, not directly to the brain, but to the head. Okay. Within your skull is your brain, and there's a little bit of space around your brain before you reach the skull. So your brain and your skull, it's not sitting like this. Okay. So that's why any injury to, or not injury, force to the head will cause the brain to shake. Okay. So I don't know if you have heard this before, but if you pick up a baby, you're not supposed to shake them. A lot of people do that. They pick up the baby and then they're like, ah, kitty, kitty, kitty. Meanwhile, the baby's getting concussion. Okay, because your brain is literally shaking within your head because there's space around the brain. Okay, so that is what concussion is. It is a traumatic brain injury, right? And it is because of a sudden incident where there is a direct force or a blunt force to the head, causing the brain to shake a little bit, which is not a good thing. Okay, so how does it happen? Fights. Okay. Again, that drunk person that was just diving into the empty swimming pool is now causing trouble with his chummy. They fight. A punch against the head can cause the brain to shake, can cause concussion. Right. Okay, a fall, again, not if you fall on your bum or on your knee. It's when you fall with your head hitting against something. Alright. Playground injuries. Okay, kids climbing up those jungle gyms and falling from all the way up there because they believe they can fly. Playground injuries. Okay, car crashes, bike accidents, and then, as I mentioned, contact sports. Right. Even though soccer is not a contact sport, this is contact. Okay. Right. Boxing. Your boxers, that's why they're so dumb, because they keep getting concussion on concussion on concussion on concussion. Same with rugby players. There are so many rugby players that play with a current concussion, and then they get a concussion on a concussion, which can also be fatal. Okay. Right, so these are the different causes, right? So in concussion, just think of a direct force to the head. Right. Okay, what are the symptoms? Again, you'll see a lot of the symptoms as what we saw with the whiplash, right? But there are a couple that's extra that stands out. Again, you have that headaches, right? The dizziness or feeling lightheaded. Loss of consciousness, and you may or may not have seen this, but someone who are suspected to have a concussion, or they always want to sleep, but they're told not to sleep, right? They always try to keep the person awake, right? Because in that sleep mode, they can lose consciousness, and as medical staff, you won't be able to pick it up because you think that they are sleeping. But actually, they've lost consciousness, and if that is not being monitored, then they can die, right? So people with concussion are always advised to stay awake for as long as they can get to a hospital, right? Okay, memory problems. Now remember, your brain, again, controls everything. Your brain is like the big boss, and your spinal cord is like the CEO, the one just below it, right, of your body. They are controlling everything and anything that you do, your breathing, your memory, your talking, your walking, everything that your body can do or that you as an individual can do is controlled by the brain, right? So you'll see all of these things. Memory problems, they can become irritable, they can become aggressive, or they can become very emotional, right? Concentration problems, so that's why they always ask them, do you know where you are? Do you know what happened? Do you know what your name is? Do you know what the date is, etc.? Because they need to see whether they can recall certain things, right? Slower reaction time, so they will talk slower, they will walk slower. If you throw something at them, they probably will only catch it tomorrow. So it's slow reaction times, okay? Sleep problems. Okay, so they either might feel very drowsy, as I mentioned, and want to sleep the whole time, or they actually struggle falling asleep. Okay. Now the second one is not a bad thing because you want to keep them awake, but if that maintains or remains for a longer period of time, it is also problematic. Okay, right. So as you can see, all of this are things that are controlled by your brain. Okay, These symptoms also very different from other traumatic injuries that we have covered, right? So please take notes of this. Okay, now treatment. You will see there that there's no physio, there's no bio, there's no chiro. It's medical doctors, okay? Because it's the big boss that now got hurt, okay? Your medical doctors will examine them, they will do a full medical exam on them, send them for all the necessary scans, x-rays, CT scans, MRI, you name it. That will be the process, okay? There's no operation because nothing is broken, okay? You cannot break your brain, okay? But it got damaged, okay? Because it got damaged, all the internal things got damaged, okay? So they are being assessed in hospital. They remain hospitalized for a certain period until all those symptoms have cleared up, right? Even if that individual wants to return to sport, or if that individual wants to return to just their daily activities, they need to be cleared by the medical doctor who examined them, right? It's not to say that that individual can't go for physio or bio, but they are only allowed to go see those professionals once the symptoms have disappeared. Right. What a bio and a physio will do, physio if there's still pain in the cervical region, because remember, even though it's a hit to the head, your muscles are still responsible for maintaining your head upright. So the muscles may have become stiff or tight or even painful, so they will manage that. If there's inflammation, they will manage that. If there's swelling, they will manage that. Right. Bio, same thing, you will start with more like daily activities for them to do, and while doing exercises we will focus a lot on their balance, we will focus a lot on like their recollection, okay? We provide them with 5 words, we let them do an exercise and then they need to repeat those 5 words. Or coordination exercises like your finger to nose type thing, alright? So it's not as much strengthening and getting the muscles strong, but it's working on the finer things, your coordination, your memory, those type of things, right? And also, individual with concussion, there's no time frame to it, right? So we can't say, okay, after 12 weeks you can return back to your sport or return back to gym or return to your daily activities, because it's very dependent on when these symptoms disappear. Right. Any questions?
Ma'am, what happens with the surgery of the cervical fracture?
What happens with the?
With the fractured cervical vertebrae? Is it like removed?
Yeah, so during the operation, they will replace it with a, what's that? I'm just looking for the word, but it's like a fake vertebra. So they remove all the pieces because it depends how bad it is. Sometimes only a little bit of the vertebra will break off. Sometimes the whole thing shatters. So then they will put like a replacement vertebra in that. So they will remove everything and then replace it. If only some section of it has been broken off, then they will replace just that little section of the thing.
So some whiplash and cervical fracture cases can cause concussions.
Yes, definitely, definitely. So those 3 usually go together in terms of how they assess the patient, right? Because you can't really distinguish between the 3 unless you have your scans done, right? So if it is whiplash, but there's nothing fractured, well, if the cervical spine is painful, for example, they take for imaging, if they see nothing is broken, then they say, okay, it's either whiplash or it's concussion, right? Then they say, okay, what are the symptoms that the patient is experiencing? If it is a lot of things like memory, vision, can't remember like words, can't calculate simple maths, then they go, okay, concussion, right? So it's like a process of elimination, but all of that is only done through x-rays or CT scans or MRI. But usually those 3 go together. So you can have concussion with whiplash. You can have concussion with a cervical fracture because it's damage to this area, and it's usually because of like a blunt force. Okay. Alright, okay guys, so that concludes all our injuries that we had to cover. So as I mentioned, the next one is not too hectic, and this is the prevention of sports injuries. Okay, and you will see some of the things we've covered as we went through the different conditions, especially in terms of like what causes the injury, so the risk factors, right? Now, do you think that we can completely prevent sports injuries? Do you think we can stop sports injuries from taking place?
Not completely.
Some of them, yeah.
Yeah.
So we cannot completely stop sports injuries from happening, right? I mean, if you get tackled in the incorrect form in rugby, an injury is going to happen, right? Overuse injuries, yes. Maybe there we can place our focus on and say, yes, we can prevent majority of the overuse injuries. But traumatic injuries happen because of a specific incident, right? You cannot stop a car accident from happening if you can't foresee it happening, right? You cannot stop yourself from falling off a horse, for example, if you don't know that it's going to happen, right? So when it comes to sports injuries, the first thing we need to do is we identify the risk factors, okay, or the causes. Most of your overuse injuries are because of things that we can change, okay? Either a muscle is too tight, or a muscle is too weak, or it's because of the way our posture is, or it is because of a lack of fitness. Those are things that we can manage, okay? We can stretch a muscle that's too tight, we can strengthen a muscle that's too weak, we can fix our posture, we can make sure that we are physically conditioned enough to participate in the sport or the activity. So those are things that we can change, right? Some of the things are internal factors and some are external factors, okay? When we covered ACL, I said females are more likely to get an ACL injury than males, alright? Now that is an intrinsic factor that you cannot change, right? You are either male or you are female, okay? I know there's a lot of variations nowadays, okay? But you're either born male or female, right? So whether you were now born male or female is not something you can change in terms of your risk for injuries, okay? Age, for example, if we look at lumbago, we said your younger athletes and then your mid-adulthood, if you want to call it that, okay? They are more, lumbago, low back pain is more common in those individuals, right? Age, again, it's an intrinsic factor, it's not something that you can change, all right? So we're going to look at intrinsic factors or internal factors and external factors, right? So when we look at extrinsic factors or external factors, right? These are the things that does not belong to the individual, okay? So it's nothing that we can change on the individual's body or the systems within their body, right? But there might be things here that we can change or modify a little bit, right? And that's why we have modifiable risk factors and non-modifiable risk factors. Modifiable risk factors means it's risk factors that we can change to reduce the risk of injury. Non-modifiable risk factors is factors that we cannot change at all, like age, for example, all right? So if we look at extrinsic factors, training errors, okay? You were assigned a coach and you do everything that that coach tells you to do, right? The amount of days that you should do it, the exercises that you should do, for how long you should do it, etc. You trust that coach to train you so that you can participate in the sport, right? But it doesn't mean that that coach knows everything about everything, okay? Training errors can creep in. Okay, we know of overtraining or fatigue that kicks in, right? So in coaches at like top level clubs, they will push athletes, push until they burn out, and that is a training error, okay, because you weren't taught the correct way to train, or you were pushed until the limits and then you broke down, okay? So training errors are things that we can change, but in order to do that, we need to educate the coaches, okay? Playing surfaces, do you think we can change playing surfaces?
Yeah, if they're uneven and not well maintained, that's an error.
Okay, so in terms of maintenance, we can change it, right? But if we say that netball takes place on a netball court, rugby takes place on a rugby field, soccer takes place on a soccer field or a soccer pitch, those are not things we can change. We can't now say all of a sudden, okay, rugby is going to be played on a netball court, for example, okay? But we can change how it looks, okay, so maintenance, right? Then we look at, okay, the terrain is what I spoke about, grass or tartan or the court or whatever. Okay, then we talk about shoes. Okay, now we know that in specific sports you need to wear specific shoes, right? You get netball tackies, you get rugby boots, you get soccer boots, you get hockey boots, and all of them are designed a little bit different because it needs to fit the sport, okay, and what is required from the sport, right? Now, we cannot change the shoe that you are supposed to wear, right? But we can change the way your shoe looks. If your shoe is worn out, injuries can happen. So if you get new shoes for that specific sport, then possibly you can reduce the risk of injuries, right? But we cannot now all of a sudden tell a netball player to wear rugby boots when they are playing netball, okay? Then we look at technique, right? So the way that you perform your sport, there's a specific technique, right? You can't only come in, for example, javelin throwing and sommer just gooi, okay? There's a specific technique that you need to use, right? Now again, here's where the coaches come in because they are supposed to teach you the correct technique. But if you don't have the correct technique, then injuries can happen, right? Do you think we can change technique?
Definitely, yes,
Yeah, it's something that someone, and that's hopefully a coach for that specific sport, can teach you, and hopefully that is the correct technique. Alright, so we can change it. Okay, then we look at equipment, right? Equipment is general things that we cannot change, right? In rugby, they use a rugby ball, okay? In cricket, they use a cricket bat and a ball. In javelin, they use a javelin. In discus, they use a discus. Okay, we can't change the equipment. Again, we can change the way the equipment looks in terms of are they being maintained and those type of things, all right? But we cannot change equipment in general. Officiating and rules, you cannot change the perception of the referee that's been in the game for 10 years, 20 years, right? So your referee, your officiates, we cannot change them, right? They are bound by certain rules, and that's why they became referees, okay? And the entire sport is bound by those rules. You as a player, or you as maybe a coach, cannot come in and change those rules so that it suits you, right? Rules were there with the injury prevention in mind, okay? In the past, if you look at some of the older rugby games, the way that they tackled those players, I don't even know how that was allowed. Okay, they were spear tackling the players like you guys saw on that picture earlier. Okay, so the rules are there, and it has progressed over the years so that it does help to reduce injuries, right? But we cannot control in the rules or the refs. Okay. Spectators and parents, do you think we can change them? No. We can ask them, please be nice, please support your athletes, but they're still going to say what they want, do what they want, throw water bottles on the field if they want. The parents are still going to push their kids to participate at the highest level possible. They're still going to push them in terms of training sessions. We can try and change their perceptions, but we can't change their behavior. Right, because just as you all have individual behaviors, spectators and parents also have their own behaviors. Right, environment. Can we change the environment? Not at all. That is completely out of our hands. And then pollution. Do you think we can change pollution? Do you think so? I mean, we can try. We can try. We can educate people as to why it's bad, and please drive electronic cars or electric cars, and please don't smoke, and please don't do this and that and the other. But ultimately, pollution is there. Okay, we cannot go to an environment, quickly take out all the pollution, and then let them play. Okay, so it's a factor that we can't really change. Right, then we look at intrinsic factors. Most intrinsic factors are things that we can change, right? The only things we cannot change is your gender, so your sex at birth, and then age, all right? Biomechanical abnormalities, remember we have spoken about overpronation, all right? It's something you can change. Stretching the right muscles, strengthening the right muscles can change it, all right? Balance and proprioception, we can change that. Right. You can improve your balance by doing the correct exercises. Right. Inadequate sleep, and that's supposed to be rest. We can change it. Okay. We can make sure you get more rest, more sleep, more quality sleep, etc. Being overweight or underweight, that can change. All right. Poor nutrition, it can change within reason. Dehydration, yes. Drink more water or drink your electrolytes, whatever the case may be. Alcohol abuse, yes. You should change it. You don't always want to, but you should change. Yes. Okay. And there's a whole list of other things, guys. Your posture you can change. Weak muscles you can change. Tight muscles you can change. Right. So these are all modifiable risk factors. Right. Okay. So this is. Yeah, no, that lady is insane. Okay, so this is the different steps that we can take in order to try and prevent injuries. Okay, and the focus is on try because ultimately we cannot prevent all injuries, right? So the first one is pre-participation exam and screening. Okay, now if I'm a young athlete and I'm working at a club that I now want to start doing soccer at, right? In the ideal world, okay, I want you now to realize this, to imagine this very nice world that we live in, okay? If you walk at a club as a first timer, right, you are supposed to be screened. They will ask you questions about your health. They will ask you about whether you've had any previous injuries. They will do a full body analysis on you, check what is tight, check what is weak, look at your balance, see if everything is hunky-dory. Okay. That is what is supposed to happen. It doesn't, but that is what is supposed to happen. And that's your very first step to prevent injuries. Okay. Because what do they do in this screening? Is they identify risk factors. Okay. If you know your hip flexors are tight, then you know that there's a possibility that you could experience lower back pain. We're not saying you're experiencing it now, but in the future you might experience it. Okay, so if we identify modifiable risk factors during screening, we could potentially prevent or reduce the risk of injuries. Right. The second one is good preparation and fitness. A lot of athletes get injured because they're not physically fit enough to participate in the sport. Right. You see soccer players that are tired towards the end of the first half. And when do most injuries occur? Towards the end of the first half or towards the end of a match. Same with rugby, same with hockey, same with basically any activity that you participate in. Right? So you need to be physically fit enough to participate in that specific sport. It's very sport specific. if you are a soccer player and you've been training for soccer, and now one day you decide, I now want to become a rugby player, okay? You're not going to have the same physical fitness for rugby as what you need for soccer. So now you have to go through an entire training program so that you can become fit enough for rugby. Okay. Then we look at correct posture and biomechanics, alright? We've spoken about this endlessly. During the screening, they're supposed to pick up if you have any postural abnormalities. They will see if you have any overpronation, if you have any squinting patella, if you maybe have a tilt in your pelvis, and that should then be corrected. Because if your posture is correct, the likelihood of an injury is lower. Right. Good warm-up, stretching, and cool-down. Okay, also something that doesn't always happen. In high school, when I played hockey, we arrived there at 2, we start playing a game at 2:15. It's winter, it's cold, the body is like minus something degrees. But here you are like a stick figure trying to play hockey. Okay, so a sufficient warm-up, stretching prior to training and playing a match. And then a cool down afterwards. Very important. Okay, balanced nutrition. Nutrition actually plays an important role because it can result in fatigue. If you don't eat the correct nutrients, that can influence your performance capabilities. Right. So balanced nutrition of fats, protein, carbohydrates, everything should be taken. Rest and recovery, we know, is very important. If you're not rested enough or you haven't recovered from one training session to the next, that training session is not going to be optimal, and it's probably in that training session that you're going to get hurt. Right. Same with one game to the next game, etc. Psychological readiness is a very important thing, and another thing that's being skipped, especially in our country. We don't have a lot of sports psychologists, right? So clubs or teams don't employ psychologists to ensure that an athlete is ready. Okay, now you're just exiting high school, you maybe started studying at UJ, you decide I'm going to play for UJ Sport. UJ Sport has a sports psychologist, so this is a bad example. Let's say you go to an external club, alright? It's your first time going to a club setting, you used to play for high school. Now they just expect you to be there. They expect you to be ready mentally, physically, psychologically, everything, okay? But they don't know maybe that your father passed away last year. So psychologically or mentally, this player is not ready to play. Same with someone that had an injury, that has gone through rehab, and now they're ready to return to the sport. Okay? Physically, they might be ready to return to the sport, but they still have the fear of being re-injured. A fear of re-injury is a risk factor for an injury. Okay, so psychological readiness is extremely important. We've spoken about alcohol. And then risky sexual behavior is something that forms part of injury prevention. Okay. Now, how can we prevent injuries in terms of factors outside of the body? Okay. So the first one is to wear the correct protective equipment. Right. Now we know there's rules when it comes to this as well. Okay. In the past, rugby players used to play with those shoulder pads. Okay, they don't anymore, and that has been removed. Why? I don't know, because it was a protective equipment. Right. Cricket players used to play with a shin pad and a helmet. What do they play with now? A thigh pad, a shin pad, a helmet, a shoulder pad, a hip pad, everything. They are padded all over.
And a ball guy.
Yeah, exactly. They padded all over, that ball cannot touch them. Right, but that's how the sport has evolved. Hockey players. I used to play with shin pads, mouth guard, there I go. Now shin pads, mouth guard, helmets, and I don't know what else. Okay, but it's there to protect the players. Okay, so all of these things are different protective equipment equipment that can be used to prevent or reduce the chances of an injury. Right. Then we're just going to, it jumps a little bit to something out of prevention, right? But these are just some important information as to why it is important to stretch on a regular basis, right? Because remember, we've now spoken a lot about tight muscles, right? Tight muscles result in a lot of overuse injuries. Now, in order for you to correct that is through stretching, right? So why is it important? It increases relaxation. Okay, so if you haven't stretched in your life before, usually if we stretch, let's say we do this stretch, you hold it for 20 seconds, for example. Now you can't do anything else than to focus on that stretch for 20 seconds. Okay, so it's a mind-body technique to relax. Okay, decreases muscle spasms, as we've spoken about earlier. It improves your posture and biomechanics, because remember, if you, for example, walk like this, these muscles are tight. How do we get you to stand upright? We stretch the chest muscles. Okay, now my posture is better. Right. If we look at the biomechanics, if I'm a runner, for example, and I have tight hamstring muscles, I'm going to run with very short paces. Right? My stride length is going to be very short because my hamstrings are tight. Okay. That means I am burning more energy because of the fast pace, and I get tired easier, just because my hamstrings are tight. Now I'm stretching my hamstrings. Cool, now I can lengthen my stride length. I don't have to take those fast paces anymore. I don't get as tired as quickly, so I don't fatigue soon. Right, so it benefits a lot of things. It increases blood flow, so the more that you stretch, the better your blood can reach the different areas, but also the stronger your blood flow is, right? And that decreases pain and inflammation. And then it also increases the strength of new scar tissue. Now, when you get an injury, okay, and it is a ligament or a muscle or a skin injury like a blister or ligament, muscle, skin, tendon was the other one. If any of that gets injured, okay, inflammation happens. Remember, when there's an injury, inflammation takes place, okay, because it's the natural healing process of the body. But during inflammation, it forms new scar tissue. That is the tissue that helps to correct the injured area, okay. But that scar tissue is usually very stiff, it's very tight. So the muscle, or the ligament, or the tendon, or the skin cannot function optimally, cannot stretch to where it's supposed to stretch. And the only way that you can improve that is by doing stretching. Okay. So it makes the new tissue that's been formed stronger and less tight. Okay. And then we look at the benefits of resistance exercises, because remember, we've spoken a lot about weak muscles. How can we strengthen muscles? By doing resistance exercises. Okay, so it increases blood flow, it decreases pain and inflammation. Any exercise that you do, whether it's running, picking up weights, or stretching, you are increasing blood flow. Okay, when there is better and increased blood flow, it can help to reduce pain. Okay, that's why the basis of physiotherapy and biokinetics is exercise. Right. It increases the number of your muscle fibers, so don't worry about type 2B, what. So I think I've shown you guys this. A muscle contains muscle fibers that looks like this, right? Okay. Now when there is an injury to the muscle fibers and it stretches or it tears, they separate from one another. Okay, depending either just to there or completely off, right? Now when you exercise through doing resistance exercises, okay? Now let's just start with resistance exercises. That is where there is a weight attached to it. It's either body weight exercises like normal air squats, right? Or you're picking up dumbbells, right? Or the bars, or the kettlebells, or you're using resistance bands. Those are all forms of resistance exercises. Okay. When you do resistance exercises, if you do it continuously, what happens to your muscles?
It is.
They bulk. Okay, how do they bulk? Through an increase in the number of muscle fibers. Okay, the more muscle fibers you have within a muscle, the bigger your muscle. Okay, right. Then it reverses muscle atrophy. Now, muscle atrophy is when your muscles become smaller. With an injury, the muscles around the injury is smaller. Okay. If it is a knee injury, and let's say the injury was on the right side, you will see the quadriceps, the hamstrings, smaller on the right side than it is on the uninjured side. Okay. But when you do resistance exercises, you can balance the two sides out again. Okay. Atrophy is when your muscles become smaller. Hypertrophy is when the muscles become bigger. Okay. Okay, then it also increases neuromuscular coordination. Neuro is nerve and muscular is muscle. Okay, so it increases the connection between your nerves and your muscles, right? Which helps you to move better. Then we have increased activation of motor units, right? Now within a muscle, you have your muscle belly, that is the middle section of your muscle, and it contains not only muscle fibers, but it contains motor units. And those motor units are responsible for the actual movement of the muscle. Okay. For me to do this, yes, my muscle is contracting, but how is my muscle contracting? Through the activation of my motor unit. Right. Then we have increased joint stabilization, right? Now, if a muscle is atrophied, so small, and I'm trying to stand on one leg, but now I have small muscles, now my knee is doing this, okay? Right, because there's no muscle strength, there's no joint stabilization. Okay, so the stronger your muscles, the more stable your joints, the more balance you have. Now obviously your muscle strength increases. There's a decreased risk of falling because of this one, joint stabilization, and there's improved posture. Remember this person, right? We've now stretched the chest muscles, okay? But now if we don't strengthen the muscles at the back, eventually the person's going to look like this again, right? So we usually stretch the one side and strengthen the opposite side, okay? For you guys sitting a lot, hip flexors, not me included, hip flexors are tight, okay? If I stretch my hip flexors, I need to strengthen my glute max. If there's a knee injury, and let's say the quadricep muscles are weak and my hamstrings are tight, I stretch my hamstring muscles, I strengthen my quadricep muscles. Okay. And that is that. Any questions, guys? Any questions for the upcoming test? Have you started studying? Yes, of course. Okay, guys, I have placed the breakdown onto Moodle. Please make sure that you know exactly what you need to study. Please remember it's going to be in this lecture venue. And please remember we're starting at 10:30 sharp. To get your after 11:15. Okay. Please be seated by 10:25 so that I can hand out and we can start by 10:30. Okay. Excellent. Is there anyone that didn't get back their presentation and rubric? You guys can keep them. I have uploaded those marks already. Okay, and then I will see you next week. Good luck with the preparations.
Ma'am, don't be too harsh, please.